Hello, welcome to the GLP-1 Medical Weight Loss Education webinar. We're going to talk about the science and also how to create sustainable transformation with these peptides. My name is Brittany Cano. I'm the founder of Holistic Nurse Coaches. I blend emotional regulation, science, and soul to support you in your quality of life, to really help you elevate mind, body, and spirit. I work with women who are overextended, stressed out, who've been taking care of everybody else, and now they know it's time for them to take care of themselves in this next chapter. So, without further ado, welcome. This is a topic that if you have been around me lately, I am just so excited about what is emerging in the field of longevity when it comes to peptides. So that's what we're going to talk about today. Specifically, we're going to talk about GLP-1, and this is often used for medical weight loss, can also be used to support with stabilizing blood sugar, often prescribed for type 2 diabetes. And now people are microdosing and using it because they feel so much better and the help with lowering inflammation. So, why does any of this information matter to you? Well, obesity is a trend that is very high in the United States. And with that, for many people, comes a decrease in quality of life and a higher risk of disease. So, whether this applies directly to you, it more than likely applies directly to one of your loved ones. So, I want you to think about, what do you really want for your health? What do you really want for your life? We get so busy with our day to day that sometimes we may not even think about what's possible, or we get so used to how we're feeling or that we feel okay that we don't even realize how bad we're feeling. Maybe you want more energy. Maybe you're exhausted by the end of the day, or maybe you start your day off feeling exhausted. Perhaps you want to have more confidence again and feel comfortable in your body. You want to love what you see in the mirror, less aches and pains. I think we all would say that's a great way to feel. Maybe you have some kind of disease process, whether it's an autoimmune, high blood pressure, type 2 diabetes, and you want to put that in reversal. You want to reverse that. And also, we can turn back the biological clock we know now. So let's say you are 40 years old. Through lifestyle medicine, you have the ability to reverse your biological age to, let's say, 35 or 30, or let's say you're 60 years old. Imagine that you have the ability, when we really lock in this lifestyle medicine, to reverse your biological age to, let's say, 50, right? Not your biological age, but the age that you show based on all of your biometrics. Your biological age is going to stay the same. So, GLP-1 is a therapy that can help with quality of life. And that's really why this is an important topic personally for me to share with you, because I've seen what a difference it's made in the life of my clients, in the lives of friends, even family. Like, transformative in so many ways this can be. And also to cut through some of the misinformation, because there is still a lot of that out there. At one time, I was one who believed in the misinformation. And so I want to share more about that with you tonight. So there is an emotional side to weight loss. And like I mentioned, adults with obesity, they face 55% higher risk of depression, and more of our population than not in the United States is obese. So that's a high increase for depression risk. Also, there's a lot of shame, there's a lot of guilt that can come in the diet culture. And so, in us having this conversation today, is really to lift the stigma off of that, right? We're all doing the best that we can. It's all of our first time at life. And it's a really complex topic: diet culture, weight, all of that. There's a lot that comes with it. And there's also that emotion side. So, in working with my clients, that's something that I really emphasize is, let's talk about things. Let's be open. Let's let go of the silence. Let's shift the shame, right? And we can do that when we come together in community, or when you work with a provider who really hears you, and you get to be open and honest, and you feel safe, and you feel seen, and you feel heard. There's also that food noise. I know this is something that I struggled with for ever. And sometimes I still do, especially at night at times. And it's that constantly thinking about food or what are you going to eat? And for some people, maybe you think about food all day long, or what you're going to eat or what you're not going to eat. And that really can create a mental fatigue. There's also body image struggles that can come with weight loss and can come with weight gain, right? And that can play in with our confidence. And so, really, this journey is about confidence. It's about reclaiming your energy. It's about doing what is best for you and so that you can really enjoy your life, feel free in your body and your mind. And it's about so much more than just the number on the scale and how you look in your clothes. And I think that's something that's really, something to think about when it comes to weight loss. Yes, there's all these physical benefits, and there's also emotional value and mental value that comes when we feel good in our bodies. So GLP-1, glucagon-like peptide, was actually discovered back in 83. So this is not a new um, finding necessarily. And it's been used for type 2 diabetic patients for around 15 years, I believe, for quite a while, maybe more. So it's a natural hormone. It boosts insulin, it reduces glucagon, it slows digestion, and it also helps curb appetite. It helps regulate weight and blood sugar, and it helps with the metabolic health. So it doesn't just affect your appetite, it doesn't just help you reduce weight, it also can help with energy metabolism. It can help with reducing cholesterol, lowering blood pressure, and even people say that they feel better mentally. So some of the recent research, clinical trials show that GLP-1 therapies can reduce cardiovascular risk in kidney disease in people with obesity or type 2 diabetes. And as we know, for men, heart disease, number one killer uh, earlier in life. And then women later in life, type um, heart disease is a killer, right? It's the top killer for women, especially as we go through menopause. And so to be able to reduce cardiovascular disease is huge, considering that it's the top, disease that kills people across the whole world. So there's also emerging data saying that the co-agonist of GLP-1 and GIP, like tirzepatide, which side note, tirzepatide does seem to have greater overall weight release for people, although semaglutide is pretty close, and also less side effects. But that this combination offers, yeah, greater weight loss and also the metabolic improvements. They're also being studied for non-traditional indications. So this is still a lot of research is in the works, and this can be to see how it's helping people with Alzheimer's disease, metabolic liver, diabetic retinopathy, and sleep apnea. And then there's a groundbreaking study showing that 41% incidence of obese-linked cancers in GLP-1 users, similar to bariatric surgery, but it's potentially safer. So people using GLP-1s have a 41% less incidence of obesity linked cancer. So that's huge as well. So just thinking about what are they, what do they do? And we're going to get a little bit more into that as well. So some things that you want to know about GLP-1 if you're considering getting on one, or maybe you're already on one, but you don't know a lot about it, or perhaps your loved one. This might be something that will be helpful for them and their quality of life and their health. There are different kinds. Semaglutides, also known as Ozempic, Wegovy, Wibalicious. I'm a little tongue-tied tonight, can you tell? And it is marketed for diabetes and weight loss. Tirzepatide, which is going to work also on an additional um, agonist there, is also the GIP and the GLP-1, and it's stronger, like we mentioned. There's also new options coming out as well, and then there's some next generations that are coming out, but we're not going to go too deep into those tonight. So who benefits the most from these? Type 2 diabetes, people with type 2 diabetes for sure, people dealing with obesity or a BMI greater than 27 or equal to 27, people with cardiovascular disease. So this reduces, like we said, the risk of heart attack, stroke, heart failure. Patients with chronic kidney disease, it can slow the progression. Adults struggling with weight loss resistance despite the lifestyle change. So maybe you're somebody who you feel like you're doing all of the things and you're still not able to release the weight. This could be an option for you. And then also if you're dealing with metabolic syndrome, so high blood pressure is part of metabolic syndrome, high cholesterol, insulin resistance, all of these things. So, who's at a higher risk for complication with GLP-1? I hear that from some people that, they're concerned about that, which I tell everybody I work with, do your own research. Super, super important. Be an educated consumer. So, if you do have medullary thyroid cancer or MEN2 syndrome, this is not the peptide for you. If you're pregnant or breastfeeding, not the peptide with you. If you have severe GI disease, gastroparesis, really, really bad inflammatory bowel disease, you want to definitely make sure that this is cleared by your medical provider. If you have, you're known to have pancreatitis or gallbladder disease history, also, you want to, doesn't mean absolutely no, but you definitely want to do your research and make sure that that the benefits outweigh the risk. And then frail older adults who are already at a risk of malnutrition and muscle loss, if they lose weight too fast, also might not be the best for them. So some of the things that people do deal with, and these are manageable. And one of the things that I work with my clients who start on the GLP-1s with are holistic, natural ways to manage these symptoms. And through lifestyle medicine, a lot of this is very manageable, and if not, completely avoidable for some people. Some people don't deal with any of this. So 50% of people deal with some nausea in the beginning. 30 to 35% might have some diarrhea, 20% vomiting. Some people deal with constipation, bloating, abdominal pain, indigestion. So those GI symptoms, and that's also when we ease into the dosing and let your body have time to adjust, that can help with that, making sure you're implementing the lifestyle things we're going to go into more can help offset those symptoms as well. And then occasionally people deal with headache and fatigue. But again, there are things that you can do to support if you do have these symptoms and also prevent the symptoms. In rare cases, people have had pancreatitis, they have had gallbladder issues, and can have severe dehydration. So I'm going to talk to you about some of the clients that I've worked with and share some of their testimonies because this is so powerful. One of my clients, she shared some results with me just a couple days ago. She's 35 pounds lost. This is, her words. I took her text. Her BMI, it started out at 30.7. Now it's down to 24.7. So that's a really big drop on the BMI scale. Her body fat, this is according to a scale that she has, was 26%. Now it's down to 20. That's a really big drop in body fat, especially for a woman. Her subcutaneous fat went from 21.8 down to 18. Visceral fat, 12% to 7. And all of this is since August 8th. Side note, so she also has started implementing exercise. She started implementing making sure she's getting her protein. She also added in some additional peptides, semaglutide, to help maintain and build muscle mass and help her really with her sleep because recovery is so important. So another client said, my food noise is completely gone, my cravings are gone, and that she's just so happy that she did this. Another client, my inflammation is so much better. I've been able to reduce my thyroid medicine and I've lost almost 50 pounds. This has changed my life. Another client, when I started perimenopause, everything in my body changed. Before I started this, I was sluggish, bloated, and couldn't lose weight. And I hear that a lot from people at the beginning. Like, I don't know what happened to my body. It's totally different. I can't lose weight. I used to be able to, lose weight, release weight quick and easy. And it's like everything I used to do is just not working anymore. And she said, I have my life back and my body back. And of course, these results are going to vary. I can't guarantee anybody results, but these are really powerful testimonies. And I think, hearing other people's story makes it so relatable. So one of the reasons I wanted to get in this space of peptides, of GLP-1s, is to make sure it's a piece of the puzzle, right? Because you have to do this with a lifestyle approach, right? And it's also important to look at the big picture to really optimize your health. So it's so important to pair it with whole foods, so real foods. Think about things that run, things that swim. As far as the protein sources go, you want to make sure you're getting 30 grams of at least 30 to 40 grams for most people per meal, 15 to 20 grams of protein per snack. And so I have my clients in the beginning, when they're ready, log at least for a week or so. Awareness is really powerful when you realize how much protein you are getting or you're not getting, how much fiber you're getting or you're not getting. How are you doing with your micronutrient goals? Um, your whole food. Are you eating real food? Are you eating fruits and vegetables and legumes and nuts and things in their natural form before they've been processed? Are you eating the color of the rainbow, or are you kind of sticking with processed foods or fried foods, breads, pastas, those kinds of things? Also, so important to pair this with daily movement and also strength training. You absolutely need to do that because when you release the weight, you're going to release fat, but you're also going to release muscle. And so we want to offset your muscle loss. So, so important. And we don't want you to lose your bone mass. We really want to keep our bones strong and healthy. And so you have to do this with lifestyle medicine. You have to do this with that nutrition piece, with that movement piece, with prioritizing sleep, with making sure you're like looking at the big picture here, mental health, emotional health, and that's really where I support. And here's the thing, it's a process, right? One thing at a time. If you don't make these lifestyle changes and you're not on this medication forever, because a lot of people are not going to be on these forever, you more than likely will not be able to keep your weight off. And so it's so important to build these foundational healthy habits while you have this beautiful tool to help you do so. And this really is such a strong foundation for so many people. And really, when you feel crappy, when you're tired, when you have aches and pains, when you're overwhelmed in the mind, when you have that food noise and cravings, it can be so hard to make those changes. It's not impossible, but this can be a foundational piece to make this lifestyle shift that much more easy, right? So it doesn't have to be so freaking hard. Also, if you don't keep your muscle and build your muscle, you're going to have a weaker metabolism. You're going to be more tired and you're going to be more frail. We want to not only live longer, we want to have better quality of life and be able to do all the things we want to do, right? What do you want to do? I want to hear from you. What are the things that make it worthwhile for you to invest in your health? What do you want to enjoy? Of course, long-term well-being is going to require more than just appetite suppressant. And we also want to look at how can you optimize your sleep? How can you help with hormonal balance? Social relationships are going to be so important. Clients that work with me have the option to be plugged into community as well. You also have me as your guide, me as your support, as well as your medical team. Also, managing stress is huge. Y'all know that that's my wheelhouse, right? Supporting you in managing stress, lowering cortisol, that nervous system regulation piece. So if you're thinking about starting on these, or you want to know, is this the best next step for me, right? I always, like I said, encourage you, do your research, some questions you can ask. Am I a good candidate for this based on my health and my risk factors? What are the things that you should expect? And we kind of went over some of that. Weight loss, blood sugar stabilization, improvement heart health. Some people report that they have less aches and pains, improvement in disease processes. What are the risks or the side effects that I should watch out for? We talked about that. How will you monitor your progress? Blood work is a great way. Vital signs, your body composition, your symptoms, how you feel, and what lifestyle changes should I pair with the medication. And we talked about that. Please, please, please know that the lifestyle piece is such a foundational part of this journey. Labs that you might ask your provider for: an A1C, fasting glucose, insulin, cholesterol panel, triglycerides, ApoB, lipoprotein A, CRP, homocysteine, checking your inflammatory markers, kidney, right? Kidney function, and ALT, IST, check the liver, and then also thyroid panel. I like for my clients to get thyroid antibodies and do an in-depth thyroid panel, vitamin D, cortisol too. You can also take cortisol by saliva. And then things you're going to want to share with your medical provider: all medications you're on, supplements, your family, know your family history. Also be aware if you have any history of pancreatitis, gallbladder, GI, or autoimmune. Important to share all of that with your provider as well. So I want to talk to you about how quality matters. Clients come to me and say, "Oh my gosh, I found these peptides or I found this GLP-1 here for this price." There are a lot of companies now that have research grade, not for human consumption, peptides. And so it's important, myself as a nurse, I cannot recommend to you a research grade peptide. I can only recommend to you prescription grade peptides that are medically supervised. And honestly, that's a very safe way to go about it. So when clients work with me, they're going to get medical supervision. You're going to have a medical provider that you can connect with in your patient portal. You go through a screening process. And so I love that piece for your safety. You also have me in your wheelhouse. And I've been a nurse for almost 20 years. I'm here as your coach. I have peptide holistic longevity wellness protocols that you receive when we work together, the pharmacy that we go through, NABP accredited compounding pharmacy. There's rigorous protocols. There's also third-party testing. So everything is checked for safety, it's checked for purity, it's checked for potency. Last time I heard the GLP-1s were tested at 114 to 117% potency, which is good. You want that. I've heard from people, "Hey, I'm on this GLP-1, I'm not losing any weight at all." I wonder, how potent is it? You have to wonder, right? And also making sure you find the dose that works for you and you're pairing it with that lifestyle piece. We have community, like I mentioned. Also important to note that if you have an FSA or HSA, you can use that. This is a medical expense. And also there's financing options. And right now, you have the option if you want to customize your GLP. And we're going to get into that a little bit more. So the NAD plus, lysine, L-carnitine, and B12 are things that you can customize. And right now, until Monday, 11/17, whenever you customize, so whether you customize them with B12, it can help them, might help with metabolic balance, nerve regeneration, energy metabolism, which, side note, the gift is going to be a 3-month supply of injections for B12. So I would say, look at these other options here. The NAD plus only comes in the oral form. Typically, you're going to want to do this in injection form. You're going to get the best bioavailability and typically the best results if you're going to go through injection. So it's paired up with L-carnitine, which may help with exercise recovery, fat metabolism, and energy production. You have the choice of lysine, which may help with muscle preservation, sleep, quality, and cognitive function. If you're going to do an oral GLP, there's the NAD plus, which can help with cognitive function repair, DNA, support the energy production. And so this is a really awesome promotion going on right now. If you want to get in on it, I say this is the time to do it because you're going to get a 3-month supply of B12. All of my clients, we could go through a consult. You have a coaching call, one-on-one coaching call that we do together to make sure you're started. You have a plan. You feel ready, not only physically but also mentally. You have me as a resource. Many clients do weekly or biweekly check-ins with me. Like I said, you also have your patient portal. The process is super simple. It ships directly to your door. You go through, you fill out your medical questionnaire, you get approved, or if you don't get approved automatically, you may have a call or a video chat with your medical provider. From there, it's going to ship directly to your house, easy peasy. And it's super quick. It's easy. I don't know what else to say about that. So options, I'll post my link if you want to set up a time to chat and explore this a little bit more. Maybe you're like, I already know this is what I want to do. So I'll also be able to give you my link. Just go ahead and ask. And I really look forward to being on this journey with you. There's also other peptides if you're like, I don't need to lose weight, but I do want to build muscle. I need better sleep. I want to help with my recovery. Or maybe your libido is like non-existent. So there are peptides, which peptides are short chain amino acids that act as messengers. They act as healing devices for the body. They turn on specific healing functions. The body recognizes it. We have we're made up of amino acids. So I want to thank you so much for joining. Please drop any questions below. You can reach out to me personally. You can reach my website. I'll share the links for us to either set up a consult or for you to visit the site, check it out, and look forward to connecting with you. Have a great day.